all you cool cats and kittens. It's day 7 with Mrs. Bartlett. Today we're going to learn about flattening the curve to ensure that everyone who needs treatment receives it. I found this cool graphic. It actually was a GIF, but I did a screenshot. And you can see that social distancing, obviously very effective, because if this person right here works from home, then he or she is not contracting the virus and not spreading it to other people. This person stays home, now we're not spreading it again. So the coronavirus is already here. It's hidden and it's growing exponentially, but you already know that. If you're wondering how this will affect our community, it's easy to know because we already have several places to which we can compare our situation. And those are in our country and outside of our country. First of all, the fatality rate. The World Health Organization, WHO, quotes it as 3.4%. That's 3.4% of the people who contract coronavirus will go on to die. And that's worldwide. For the United States, it's probably going to be different. And that's because that percent varies from place to place depending on the population density, available medical care, age of the population, and a whole lot of more things. It also requires a complex calculation to figure out, and we aren't even close to having final numbers. That's probably going to take close to 2 or 3 years, seriously. So we're just going to pretend that it's 3.4% right now. In my opinion, and this is my opinion, I think that in the US it's probably going to be closer to 0.6 to 1% for the disease itself. However, if our healthcare system is severely strained, for example, the medical staff gets sick and has to quarantine for 14 days, because they would, there aren't enough resources to properly treat patients, etc., then that number could be closer to 4%. And obviously, the higher the number, the more strain it puts on our healthcare system. Right now, about 20% of cases require hospitalization. That's an average, and it fluctuates from day to day and state to state and county to county. Approximately 5% of the cases require intensive care unit, an intensive care unit bed, or ICU, and around 2.5% require extreme intensive care. So they will need the help of a ventilator or an ECMO to sustain their breathing. And that's why we need to flatten the curve. 20% is a lot of people in the hospital. COVID-19 is a pandemic now, and no one is to blame. It's just how viruses work. I know there's a lot of blame being thrown away, but that's how they work. They mutate and then they spread. And though it can't be eliminated, we can take steps to reduce its impact. To begin, we can work to reduce, or at least spread out, the number of infections as much as possible. This will allow our healthcare system to best handle the cases that do arise, which in turn will drive down the fatality rate. And if we're able to spread this out over a long period of time, we will reach a point where the rest of society can be vaccinated, eliminating the risk altogether. So our goal is not to eliminate the coronavirus infection, because we can't. It's to postpone and spread out those infections. Imagine this, that you have 5 family members, and each of you needs to have your appendix removed, just because. I mean, it's not like urgent, but you have to have it taken out. But there's only one available hospital bed at the moment and one doctor. Would it make more sense for all of you to have your appendixes removed on the same day, or stagger the surgeries so that each of you gets the best care possible and has access to all the necessary resources? Pretty easy answer, right? So again, the more we're able to postpone cases, the better the healthcare system can function, the lower the mortality rate, and the higher the percent of population that can be vaccinated eventually. And we do this through, of course, social distancing. That's our simplest way at this point. Now, if you think back to yesterday when I showed you this Wuhan or Hubei Wuhan graph, you'll remember that as soon as there was a lockdown, so here's the lockdown, then the number of cases went down. And that's because people didn't interact with each other anymore. They were locked down. And consequently, the virus couldn't spread. The current scientific consensus is that this virus can be spread about 2 meters or 6 feet if somebody coughs or sneezes. Otherwise, the droplets fall to the ground and they don't infect you. Suppression requires heavy social distancing. So we're suppressing the level of people infected. People need to stop hanging out in order to drop the transmission rate. Remember the R naught from about 2 to 3, which is the normal R naught or spread rate without protective measures, to below 1, because at below 1, the virus eventually dies out. And I say die in quotes because viruses aren't actually alive, but we'll talk about that next week. Social distancing measures require cities and states to close companies, shops, mass transit, schools, and enforce lockdowns. The earlier the heavy measures are imposed, the less time you need to keep them, and the easier it is to identify brewing cases, and the fewer people get infected. So some of you have asked, like, how long is this going to be till we can get back to normal? Well, the more we follow the directions now, the more that we abide by the social distancing order, the faster we get back to normal. The most likely mode of infection at that point is by touching contaminated surfaces. As you now know, the virus can survive for days on different surfaces like metal, ceramics, plastic. That means things like doorknobs, tables, or elevator buttons can be terrible infection vectors. And vectors are just sites of possible transmission. And I have this graphic right here. You can see this one person affecting 2.5. 30 days later, that one person has now infected 406 people. Or if we cut it in half, 50% less exposure, the one person infects only 1.25, and 30 days later, only 15 are infected. I know it seems like it would be half of 406, like 203, but remember the lily pad thing, that's not how exponential growth works. And if there is 75% less exposure, so you're maybe going to the store once a week for supplies, then 0.625 people get infected, and over 30 days, only 2.5 people are infected. Obviously, proper hand washing and the use of hand sanitizer can help, but the only way to truly flatten the curve is through social distancing. The more and the longer that we stay at home, the faster things can return to normal. Here's another way to think about it. Let's say that store X receives a shipment of 250 packs of toilet paper every Tuesday. 50 people come into the store on Tuesday, and each person buys 5 packs. Now toilet paper is out for the entire week. A whole bunch of people and families are gonna have to go without, and that, not a good situation, obviously. And the supply is extremely limited, so now toilet paper is this, I guess, limiting factor, although nobody's life depends on it, probably. What if instead, however, of those 50 people buying 5, what if instead the people were only allowed to buy 2 packs? Well, in that case, 125 people would have had supplies for the next week or two, enough toilet paper. Or even better, if people were only allowed 1 pack, then 250 people or families would be set for the week. Heck, the toilet paper probably wouldn't even sell out on Tuesday. The people could trickle into the store throughout the week and buy toilet paper all week long, assuming everybody is playing by those rules of buying just 1 pack. So if we look at this graph, and I just switched it a little bit, here is 1 week. So let's say here's Tuesday and the toilet paper comes in. Sorry, my dog's barking. This is the number of people who come in for toilet paper. So if we allow them to each buy 5 packs, look at this. We have sold out of toilet paper like right away. If, however, Store X says you only can buy 1 pack per visit, now a whole lot more people are able to have access to that toilet paper, 250 instead of this 50 right here, all bunched together, because we still got 250 rolls. It's just that they were all bought up at the beginning of the week as opposed to stretching it out. And that's why we have to flatten the curve. The bottom line is this. The threat of the spread of COVID-19 is an exponential threat. As you can see, resources like toilet paper, hand sanitizer, mask, gloves, etc. can run out quickly. We need to work together to ensure we don't exceed our healthcare system capacity or the carrying capacity. So here's where the flatten the curve is. This dotted line is the healthcare system capacity. We don't want to exceed that because then, like the appendix thing, you're not going to have access to all the resources or the one-on-one care that you need in order to get healthy as quickly as possible. So every day that there isn't social distancing, these cases grow exponentially. Limiting the number of people to whom one can spread the infection is like limiting the number of packs of toilet paper you can buy, except for that it saves lives. Kind of a big deal. So what's the outlook for Washington County? According to the Urban Institute report, in 2018, the United States had an estimated 2.2 hospital beds for every 1,000 residents, and this is nationwide. Most days, 36% of those beds are empty and available, which translates to about 0.8 or less than a single unoccupied bed for every 1,000 people. Washington County has a population of 256,348 in 2017. That was the most updated I could find. And it has an estimated 0.59 beds per 1,000 people, so lower than the country's average. That's equal to about 153 hospital beds, of which 36%, or about 55, are normally open and ready for patients. 31 of the 153 beds are ICU beds, meaning they have access to a respirator. If 25% of people in Washington County eventually contract COVID-19 this spring, that means 65,000 people in Minnesota will acquire it. Of those, approximately 20%, or 13,000, will require hospitalization. 5% of those 13,000, or 3,250, will require ICU care, and 2.5% of the infected, or 325, are going to need a ventilator. And this is why we must flatten the curve. It's so our health care system can handle and treat all the sick people and isn't severely strained or overwhelmed by all those sick people all at once. That's it for today. You should go finish your assignment. Hold on, I think Evie just walked in here. Evie! Evie! Maybe not. Come here, Evie! You can say hi to the kids. Come here! Can you say hi? Woohoo! All right. Good to see you guys, and